So this is Dr.Misha Pepsi. I'm an obstetrician, gynecologist, infertility specialist, sonologist, laparoscopic surgeon. I practice in Selva Maternity Center, Kirtkatlai. Today I'm going to discuss a very common topic. It's called as the recurrent pregnancy loss. What is this recurrent pregnancy loss? Recurrent pregnancy loss is defined as 3 or 4 consecutive abortions. You call it as a recurrent pregnancy loss. This usually affects 1% of the general population. It's the first trimester abortion, which happens in the general population. It constitutes about 1%, and about 2 to 3% of second trimester losses in a general population. So this is about the incidence. And what are the causes for recurrent pregnancy losses? Okay, so coming to the causes, the first cause is the anatomical, or the most common cause for the recurrent pregnancy loss is chromosomal abnormalities. Your doctor would say that when you abort less than 10 weeks or 12 weeks, the first trimester loss constitute mostly towards the chromosomal abnormalities. Okay, when you have the chromosome, defective chromosome, either it could be the maternal or the paternal. So whatever it is, when you have a chromosomal problems, you can land up in abortion. That's the first thing. The most common thing is, we recently, patients get married at very early age or very late age. The increased maternal age could be one of the most important factors for having this recurrent pregnancy loss. For example, pregnancy which happens after the age of 35, and the paternal age also plays a very important role, where the paternal age is also more than 35 or 40, constitutes we do not know about the quality of the egg, we do not know about the quality of the sperm. So thereby it indicates, they can have an abortion, an early trimester abortion. So coming to the age, and then comes your chromosomal abnormalities. Chromosomal abnormalities constitute about, the major part of the abortion constitutes for chromosomal abnormalities. So you have a lot of chromosomal abnormalities like parental dislocation or like trisomy, triploidy, all those things. So your doctor will tell you what sort of chromosomal abnormality once it has been aborted, and once the aborted material has been sent for testing, and there we'll come to know what sort of a chromosomal abnormality if you really have. That's about the first thing. Second thing is the anatomical problems, like anatomically. What is anatomy? Anatomy is like a normal uterus or normal ovaries. You have a normal uterus. Normally, you can have a lot of defective problems over the uterus, where the uterus, you can have an inner lining where you call it as a bicon. The structure of the uterus might be deformed, where, see, normally inside of the uterus, it will be like a triangle, where you can have a septum, or the uterus might be double. You call it as a double uterus or bicornate uterus, or there can be a septum inside the uterus, or it's just a half a septum. Like that, you have various deformities of the uterus. When you have a deformed uterus, you can still land up in an abortion. Okay, so that's about the second thing. Or sometimes the mouth of the uterus, you call it as a cervix. When that cervix is normally, it should be closed. Okay, so the only then it's like a door. It's like a door where the baby should be retained inside and the door should be closed. Sometimes what will happen, the cervix will be very weak. The mouth of the uterus might be very weak, so it might open and the baby might come down. You call it as a cervical incompetence, which can happen in a lot of people. So that your doctor will check around, like early in the early weeks, we always check for the cervix length. So that could be one of the factors. These all fall under anatomical difficulty and deformities. That could be one of the second most important factor. The third important factor is about the infections. When you have repeated abortions, your doctor will always test for certain infections. You call it as torch. So you have a lot of tests like toxoplasmosis, cytomegalovirus, herpes. You have a lot of infections. So your doctor will, it's just a simple blood test which will tell you if you really had infection, and because of that, whether you had an abortion. So all these needs to be tested. So first comes your age, next comes your population or something like that, your socioeconomic factors, your chromosomal abnormalities, your infections, and next most important thing is autoimmune disease. You call it as, like thrombophilia, or any thrombophilic factors, where you have a defect in your blood. The blood might not coagulate or something like that, where you have a deformed, your blood might not coagulate. So there can be a difficulty in the blood coagulation system, and that could be the cause for having a recurrent abortion. So your doctors again will check, will do a few blood tests like protein C, protein S, APLA, antithrombin 3, lupus anticoagulant. So these are the common blood tests which your doctor would see for having a to find out the cause for having a recurrent abortion. In case if you have a genetic problem, or not the genetic problem, maybe your blood coagulation defect, you still have injections, you still have tablets to prevent the recurrent pregnancy loss. Next comes the karyotyping. That's the most important test. Your doctor would definitely do a maternal karyotyping, a blood test, a simple blood test from the mother and a simple blood test from the father's side. So both these blood tests will be sent to the lab to find out if your karyotyping is normal, cytogenetically, if your karyotyping is normal. That's like again a chromosomal test. So that will also tell you. See, sometimes there's a condition called mosaicism where the male has the chromosomal problem. So in case if the wife conceives with the husband's sperm, always she'll have an abortion. It is addictive. So it's like after maybe till if she's going to conceive, she might conceive very quickly, but it might land up in abortion as long as she's going to conceive with her husband's sperm. So in that case also we still have, we have a lot of test pre-genetic diagnosis and where we remove that the chromosome or whatever, and then we will, you can undergo treatment, the husbands can undergo treatment to have a safe baby. So you recently found out that the DNA fragmentation has also played a major role to find out this recurrent, if the factor is due to the male. So again, why would we, how would we treat recurrent pregnancy loss? The treatment is very simple. We would start on all the supports. Your pregnancy is not only precious to you, it is precious to us as well. So we always start with all the possible supports. Your doctor might start you on folic acid, your doctor might start you on aspirin, then the heparin injection, and they might give you progesterone supports, and we would have a close monitoring. We would do frequent scans to make sure that you and your baby are safe. We always check your medical disorders, and then finally we go in for cervical, for patients who have cervical incompetence, we stitch the cervix, which means we will close the door so that the baby doesn't come out. So we do that, and strict bed rest is not advisable, because as long as you keep mobile, it's also always fine. And then we still have few genetic treatment also. We would try to remove the particular, the chromosome which is defective, and then we will, you can always undergo ICSI, so that, the genetic disorders will not be transmitted to your baby, and so the pregnancy also becomes very survivable. So treatment wise, it's very simple. The just thing is, we have to diagnose what we have to find out where we are lacking, and then we'll have to treat the particular cause. So we can always find out that also. So there are a lot of tests. These in the recent the criteria, the recent study, modern medicine. There is nothing without medicine. You have a cure for everything. Just have trust at patients, and your doctors will tell you what sort of test should be done. And this recurrent pregnancy loss is easily treatable. So don't worry about patients who have recurrent pregnancy loss. You don't have to worry. Just meet your doctor for further clarification. Thank you.